President-elect Trump promises he will get rid of Obamacare, replace it with a plan by proposed Health Secretary Tom Price. But Price has created a rift between America's doctors. At least the New York Times says so in this headline. Trump's Health Secretary pick leaves nation's doctors divided. Now, listen to what Dr. Marc Siegel said about that earlier.
Dr. Tom Price, who's Trump's nominee for HHS Secretary, has been coming up with very concrete solutions. Obamacare's costing us $1 trillion. Medicaid, he can scale back Medicaid in ways with block grants that decrease the expenditure over a decade by $1 trillion. That's a lot of money saved. Increase free choice, decrease regulation, government overreach. That's the word of the day today.
That's the word of the day today. Look who is back by popular demand. Dr. Marc Siegel, you say, and you said this earlier, this is a hit piece by the New York Times. What do you mean by that? Why such strong language?
Well, first of all, let's start with the fact that Dr. Price is in a great tradition of Dr. Louis Sullivan, another Georgia physician who served under Bush 41 and actually started the Morehouse School of Medicine. Huge accomplishments of a physician. There's been only a few physicians as HHS Secretary, but Sullivan is a great predecessor here of Trump's nominee. Now, why I'm calling this a hit piece, Ashley, is because the AMA, the American Medical Association, 235,000 members, one of whom, Dr. Price, is a delegate. Guess what? They were for Obamacare, and I came on this show many times and criticized them for that. They're a huge supporter of Obamacare, but they have now come out and given very strong support to Dr. Price. That's the headline. So why is the New York Times saying that the headline is doctors are divided when the AMA, who has every reason not to support Price, gives them a strong endorsement? They give us an example. 5,000 physicians who circulate a petition. But maybe they haven't done their math properly. How does 5,000 compare to 235,000? And why would a physician not support Dr. Price?
Well, that was my next question.
I mean, Dr. Price, Dr. Price wants medical malpractice reform. We all love that. He wants less regulation in the doctor's office. We all love that. He wants more.
Who are the 5,000 that don't?
Well, probably those that are receiving salaries from an Obamacare-related activity. I mean, you know, Obamacare never focused on the physician shortage. It never focused on our unhappiness.
Which is chronic.
Chronic. Never focused on our problem with malpractice, frivolous suits, and never focused on our problem with not being paid. So, doctors out there, I ask you, I think you would support this nominee. We want we want a doctor at HHS.
We do. And just to get back to that.
And a legislator who's done a lot on health reform.
So how easy will it be for the Trump administration and Mr. Price to get this through, these kind of reforms through?
Well, as I said previous, I think that getting Obamacare repealed is going to be easy. As your previous guest said, you know, you can do it through the same budget reconciliation process that got it passed. You don't need 60 senators. You're going to have to replace it piece by piece, and I think that's how it's going to be done. Once it's repealed, the next stop will be, you know, let's keep pre-existing conditions, but let's create high-risk pools. Let's make all premiums tax deductible. Let's expand health savings accounts. Let's do Medicaid block grants. Let's keep the Medicaid expansion, but let's make it more efficient. So piece by piece over a couple of years.
Dr. Marc Siegel, fired up
Price
today.
Is the man.
Price is the man. And you are fired up.
He's the doctor.
He's the doctor. Dr. Siegel, thank you very much. Appreciate it. All right.